Hi, good afternoon. This is Tanya Atagi with Atagi Plastic Surgery here in the southern part of the Denver metro area. And welcome to we're calling our 101 series, but we're going to be talking about breast reductions today, or reduction mammoplasties is the kind of technical medical term. But it is a very popular, common, and very well accepted procedure for the bust line. So I have a list. I put it on a little post-it to try to remember the whole laundry list of different types of signs and symptoms that can be potentially caused by having a very full bust line, because I didn't want to forget them, and I'm sure there are several more. But some of the things that you might experience from having a full bust line are headaches, breast pain, neck, upper back, lower back, shoulder, generalized back pain, shoulder grooving, which are those big indentations that you can develop from the weight of your bra straps, upper extremity numbness, tingling in your fingers or arms, kind of a slouched posture due to the fullness or heaviness of the bust line, or even just trying to hide the fullness in the bust line. That's called kyphosis. Rashes underneath the breasts, and really having had to experience getting custom breast or bras made, having physical therapy for your back or any of the other symptoms that I had talked about, seeing a chiropractor, needing frequent adjustments, acupuncture, massage, all those kinds of things can result from just carrying full breasts. So I would say with the breast reduction procedure, it's one of the most satisfying procedures for both the surgeon and the patient, because our patients tend to be very happy that they went through the procedure. And I would say one of the most common comments that we get is, "I don't know why I waited so long to do this." So a couple of reasons that someone might want to delay, other than really just not being sure about having surgery or having trepidations about going into a somewhat elective procedure, might be just waiting till you're done nursing and whatnot. At the same time, I would say we also get a large number of younger patients who really just want to be able to enjoy their lives as far as their activities and things, because it can definitely be a limiter as far as just participating in all the different things that you might want to participate in, whether it's due to being self-conscious, having to wear 3 sports bras to strap the girls in, whether it's just being uncomfortable, heavy, and it can contribute to carrying a little bit of extra weight just because it's very hard to stay active. So with the procedure, we always recommend a consultation where I'll do a physical exam. We'll talk about some of the different symptoms that you might be experiencing. I'll do a lump and bump check. And we can certainly talk, of course, about size-wise where one might want to be. And so with that, we can talk about the surgical procedure itself. So I do the procedure under general anesthetic. I just think it's the nicest, safest, most comfortable way as a patient to have the procedure done. So you'll be completely asleep. And there are lots of different techniques for breast reduction. But the technique that I've been the happiest with is called a superior medial pedicle technique. And basically that's just a fancy way of letting a person know where the blood supply is to the nipple. So as in contrast to some people who might think that the nipple gets completely removed, and sometimes we do that, particularly for a really large reduction, or if the circulation during the surgical procedure to the nipple area in particular doesn't look really robust. But really the vast majority of time we're able to leave the nipple attached to the breast tissue, and that helps to maintain sensitivity to the nipple and that whole area. And so basically I like this technique because the blood supply is still attached to the upper inner part of the breast. And what I try to do is I loosen up the skin and rotate the breast tissue up, and we tuck that up into the upper pole of the breast. And so what we're trying to do, and sorry, your phone is ringing, is try to give more fullness up on top, because I would say most of our patients that have a full bust line tend to have a lot of slopiness to the top part of the breast and want a little bit more fullness. So we do try not only to reduce, but give the breast a nice shape. So we're also lifting. So the lift part is basically automatic. So you get an automatic lift out of the procedure as well. So you're going to be perkier, and we try to minimize the amount of skin on skin, meaning where the breast tissue is resting on the tummy tissue. And that helps with rashes and that sort of thing. So the scar is often what we call an anchor scar, but it also depends on how much lifting that we're needing to do. But I would say most often it's an anchor scar, which goes around the areola, down the front of the breast. That one doesn't show very much really, and then underneath the breast. So lengthwise, it may seem like it's a pretty long scar. At the same time, there are a lot of great places to hide the scar in those areas. So there's a natural color change between the areola and the breast skin. So that's a great place to hide the scar. Like I said, the vertical one, really, you don't see very much of it. And underneath, you have a natural crease in the shadow of the breast. So that really helps to camouflage that scar. Most patients come out with the sensitivity to their nipple and all of the breast skin intact, but unfortunately one of the risks of any kind of breast surgery is losing sensitivity to the nipple area. So that's something to be aware of. Studies show that most women are able to nurse after, but I would also say, you know, nursing is one of those kind of squirrely things where you might not have had any breast surgery at all, and at the same time aren't able to nurse. And so if that's something that's really important to you and you're one of our younger patients, then you might want to think about having the procedure done after you're done with having children and nursing. At the same time, like I said, most studies show that patients are able to nurse even after a breast reduction. So the procedure can be very rewarding. People tend to do very well with it, are really happy, and as I mentioned before, one of the most common comments that we get following surgery is, I don't really know why I waited so long to do it. But it can be very liberating, getting rid of that extra weight, and it can help with a lot of symptoms in terms of, as I mentioned, headaches, back pain, shoulder grooving, rashes, all those sorts of things. So if it's something that you're thinking about, please give us a call. Our local number is 303-327-7300, and visit us at our website for some before and after pictures, as well as maybe some more details about the procedure, and to look up our 800 number. And our website is www.atagimd.com, so that's ATAG, like George I, MD.com. All right, great, thank you.